Hey everybody, welcome back to the ECG of the day. Before we get started, don't forget to go into the description and download the blank PDF of today's ECG so that you can make your own notes. And while you're doing it, like and subscribe if you like the videos. So let's jump into this video and this EKG and let's try to figure out what's going on. So we start by looking at the forest, and the trees of the forest are my QRS complexes. I notice that I've got a narrow complex QRS that seems to be pretty regular, and then all of a sudden it seems like there's a little bit of a gap here. We'll come back to that gap, and then it gets regular again, and then we hit another gap. So we're going to need to explain these gaps here in a little bit. I notice that there are some P waves, and so it's reassuring. So let's figure out what is this rhythm and why. What is the rate? Start off maybe QRS that ends on this solid line, so 300, 150, 100, 75, roughly maybe just under that, maybe 70 beats per minute. So that's normal rate. And so let's figure out, first step here, what is the atria doing? We said we had some P waves. I see another P wave there. My P wave morphology appears to be somewhat upright in lead 1. I would say it's upright in lead 1. And AVF, maybe you can kind of see it upright in AVF right at the end of that T wave. So I would say this is a sinus P. We'll talk about why the P waves are starting to disappear on us here in a little bit. That's going to be part of the challenge of this rhythm. And so the next thing I look at is my PR intervals. And so this is where I'm going to start to figure out maybe why is this gap here. We're going to start to skip a couple steps to work through this. And so initially my PR interval, if you look down here, my PR interval initially is prolonged. It's greater than, my PR interval is greater than 200 milliseconds, which means that there's at least a first degree AV block going on. But maybe let's see what's going on with this entire rhythm. And so what you're going to notice is, I'm going to look down here at this V5 strip. So we've got this P that conducts to this QRS. We've got this P that conducts to this QRS, but notice the PR interval got longer. And then notice that maybe you can see the end of the P wave kind of peeking through there. And then all of a sudden my P wave goes away. But what I want you to notice is look at the change in the T wave compared to the previous T wave. Does this T wave, this second T wave right here, it looks a little bit more peaky. And that's because that P wave is buried in there. So the P wave actually is buried in the previous T wave, and it conducts to this QRS. Same thing here. That P wave is buried in there and it conducts. And then you can see the peak of that T wave slowly is moving to the left. You can notice even on this one, that P wave is kind of at the beginning of the T wave. Peak, we'll say. And then this last P wave blocks. So it is blocked here. And then all of a sudden we start the cycle over with this P wave to this QRS, and it happens again and again. And then we see the P on the T wave until it blocks again. Here, you can see that P wave that doesn't conduct. And so, what is it called when our PR interval gets progressively longer and longer and longer and longer until it gets blocked? This is a second degree type 1 AV block. And so that would explain this pause, and it would explain this pause, because for both of those pauses, we see the PR intervals getting longer and longer and longer until they drop. So far, we've got a sinus rhythm with a second degree type 1 AV block. Okay, well, let's figure out the rest of the algorithm. Let's measure more intervals. Let's look at our QRS. QRS is narrow. We said our QRS is narrow. It's less than 120 milliseconds, so that's good. Our QRS is good. But our QRS axis, you'll notice that it is down in AVF, but up in lead 1. So that means we have up and to the left, we've got left axis deviation. And causes of left axis deviation, well, we see that we've got this little r deep S, and we've got this little q, big R in our lead 1 and lead 3. And so this together is criteria for a left anterior fascicular block. Remember, there are 2 fascicles, and so the left anterior fascicle, if you look at this heart here, kind of travels on the superior kind of anterolateral part of the heart. And so if you block this, you'll get late forces going toward it, which will make that deep S wave in lead 3, get the kind of the RS there. And so if you don't understand left anterior fascicular blocks, go to my other lecture video. I do talk about this in one of my lectures. And so then the next thing we're going to look at is we're going to look at our QT interval. And if I like to look at QT interval, just eyeball it. We go from QRS to QRS, and midway between, I just want to make sure my T wave ends by the midway point, which it does, and so I can eyeball and say my QT interval is appropriate. And so, yeah, let's just put that all together. And so what is this EKG's diagnosis? We've got a sinus rhythm at a rate of 70 beats per minute. We've got a 2nd degree type 1 AV block, or a Mobitz 1, and we've got a left anterior fascicular block. So important takeaways for this: when you see any type of pause or dropped beats, I want you to think, is this an AV block? Is this sinus node dysfunction? Or was this a PAC that was blocked? And so those are just a couple of things to just go ahead and initially think through. There's obviously much more than that, but those are 3 common abnormalities, and you can always, look at that anatomically and determine what the cause is. So I hope this video was helpful, and don't forget to subscribe if you like the videos, and post questions into the comments. Have a great day.